Thank you for your interest in the short leg walking boot. I'm going to take you through the features and benefits, the design highlights, the indications for use, application technique, coding, presenting to the patient, and why you should and should not use a short leg walking boot. When the walking boots were originally created a long time ago, they were considered the first affordable alternative to a short leg cast. Now, these particular products are very, very popular. They're used in all specialties. It's probably the one product that is sold to every type of medical practice because everybody sees ankle sprains. It's a very common injury. This product is designed to be used on grade 2, grade 3 ankle sprains, minor fractures of the tib fib, fractures of the foot, and it can be used for other soft tissue injuries or in the event of some form of surgical procedure on occasion as well. Now, it's available in a high top and a low top design. There's actually a lot of variations of this, but this is the one that's the most popular. This is called a polymer walking boot. Part of the reason it's the most popular is because it's very lightweight and it's exceptionally strong. This material is a combination, it's a composite material, and you can see there's a metal shank. So this product, I mean, you can roll over this with a Jeep and it's not going to break. This thing is really solid. The high top product is used predominantly for people that are very tall, or if you have a high ankle sprain or a tib fib fracture. Otherwise, the low top is a little bit more popular, partially because it's less strap, so it's less work to put it on and take it off. It's also less surface area contact, so it's not quite as bulky, it's not quite as hot. Both of them have the exact same rocker bottom, and you can see by virtue of the way the product moves, there's no flat spot. And what I mean by that is when the brace itself, when the patient does ambulate, from heel strike through toe off, it's a very natural gait. So it rocks forward and backward naturally, as well as sideways. And it rolls to the side, rock and roll. We kind of like it. It's a great brace. So the high top is very popular with high ankle sprains, tall folks, tib fib fractures. We recommend you carry just one or two of each of these in stock. You should carry more of the low top. You'll use this much more frequently. Now, when you do use it, it's very easy to apply. The Velcro straps, you open up. This is a very high quality hook and loop. It's going to last a lot longer than necessary. But once you take all the straps open, you open up the soft good, and then simply make sure that the patient's heel is all the way to the back of the brace. When their heel is to the back of the brace, that means that their foot is centered appropriately, and the struts should be on either side of the malleoli. So the ankle bone should be exactly centered in the struts. You'll know it's the wrong size if their toes are hanging off the edge, or if they're right at the edge. You might want to go up a size. You don't use the straps to tighten it down to make it any more secure. To make it a fit that's more snug, use the pneumatic system. So this bulb is attached to bladders on the medial and lateral side. When you pump this up, it creates a customized fit and compression that helps reduce edema and reduce swelling. It's an outstanding product, and you can use it throughout all stages from acute through post-rehab. Now, while the patient is wearing the product, you can also have your logo put on it too, by the way, I forgot to mention that. While the patient's wearing the product and using it, you might get to the stage where they don't have to actually wear it every day. Perhaps you step them down into an ankle support. This product is still very useful because they may have swelling. So at night, one of the things we recommend is have them open up the brace, put their foot in it, elevate. The bottom is flat, so it'll sit appropriately on a cushion or an ottoman or something like that. Put a gel pad on the inside, close it up, and then pump it up. And then you have RICE, rest, ice, compression, and elevation. So very popular product. It's approved by PDAC, which is the government agency that dictates whether or not a product is eligible to receive a HCPCS code. Our products are approved for both the L4361 and the L4360 code. Based on your particular region or state, we can tell you exactly what the reimbursement fee schedule would be for our Centers for Medicaid and Medicare Services, which you do need a license to get reimbursed through Medicare or Medicaid, but you do not need a license to get reimbursed through commercial carriers. So L4360 and L4361 will get you reimbursed from Blue Cross, Blue Shield, Aetna, United, Cigna, Humana, assuming that your contracts are fee for service. If you have a contract that is global, we'll talk to you about a self-pay rate and help you promote it to the patient in a fashion where they feel like it's an outstanding value. We also have a service where we can outsource to a third party who will do the billing for you and pay for the cost of the product for you as well. Couple things to consider when using this product and not using this product. So one of the things that we've heard is we don't want to use this, we use a splint roll because we're familiar with a splint roll. Well, when you put somebody in a splint roll, it's not adjustable during the varying stages of swelling. And if you put your patient in a splint roll and you send your patient off to a specialty practice, they're going to look at that and they're going to go, who put you in that? And they're going to take you out of the splint roll and they're going to put them in the walking boot that they're carrying. This is the most popular product. There are 8 million walking boots sold every year. So you have to have this in order to be able to treat the injuries and indications that are going to be most commonly seen in your facility. Lots and lots of injuries to the ankle. Also, there's one area that we suggest that you use it, but it's up to you whether or not if you think it makes sense. Lots of folks will use a post-op shoe or a surgical shoe for a fractured toe. It actually was not designed, a post-op shoe and a surgical shoe was not designed for a fractured toe. When the post-op shoe is put on, it opens up really wide to house a wound care dressing. That's the purpose of a post-op or surgical shoe. It's not called a fracture shoe. And the sole or the base of the shoe is flat. Now our toes work as, they kind of balance. So if you have a fractured toe and you have a flat surface and you're walking, well, your toes are going to work and it will actually impede the progress of the healing. So the walking boot, while it is a little bit overkill for a fractured toe, it helps the patient stabilize, it helps them walk a little bit more efficiently, and it actually helps relieve some of the pain that they may be feeling. So that's up to you as to whether or not you think it would be appropriate for fractures of the toe. But otherwise, you want to use this for grade 2, grade 3 ankle sprains, minor tib-fib fractures, fractures of the foot, or other soft tissue injuries. That's our short leg walking boot.